Welcome to the Defeating Epilepsy Foundation YouTube channel. At the Defeating Epilepsy Foundation, our mission is to provide the advocacy and educational resources needed to the epilepsy community and our society. We are dedicated to removing the stigma associated with epilepsy and help to create opportunities for individuals battling epilepsy. In this discussion, we will learn what ADHD is, the signs and symptoms of ADHD, types of ADHD, how does ADHD affect someone with epilepsy, and treatment for ADHD. Attention deficit hyperactivity disorder, also known as ADHD, is a neurodevelopmental disorder characterized by cognitive and behavioral symptoms such as inattention, impulsivity, hyperactivity, and disorganization. Despite being one of the most studied psychological disorders, the cause of ADHD is still unknown. Genetics may play a role due to low levels of dopamine reported in those battling ADHD. ADHD often runs in families. Symptoms of ADHD include inattention, hyperactivity, impulsivity, and disorganization. ADHD can have a significant impact on daily life, resulting in challenges at school, work, and relationships. Depending on how ADHD affects someone, they may be fidgety, restless, have difficulty paying attention, easily forget details, and can be prone to interrupting others. There are three subtypes of ADHD: predominantly hyperactive impulsive, predominantly inattentive, and combined. Predominantly hyperactive impulsive ADHD is characterized by fidgeting, difficulty sitting still, interrupting others, and feeling restless. Predominantly inattentive ADHD is characterized by having difficulty staying focused or finishing tasks, getting bored easily, and forgetting important details. Combined ADHD is characterized by an equal distribution of symptoms for both. The link between ADHD and epilepsy is not well understood. However, similarities in neurological and executive function may contribute to the association. ADHD between the general population and those with epilepsy is very different, and the most common subtype for those in the general population is combined ADHD. ADHD is more common in boys than girls. When it comes to ADHD and epilepsy, inattentive ADHD is more common and more evenly distributed between boys and girls. Around 20% of adults and 30 to 40% of children with epilepsy have ADHD compared to 2.5 to 4% and 7 to 9% of the general population. Children with epilepsy and ADHD have reported a poorer quality of life compared to children with only ADHD or only epilepsy. Proper diagnosis can improve quality of life by receiving the necessary assistance from mental health professionals and provide deeper insight and understanding of the patient's behavior. Treatment options for ADHD for patients with epilepsy include medication and behavior therapy. Stimulant medications are commonly prescribed to treat symptoms of ADHD with a reduction of symptoms for 70 to 80% of patients. For patients battling epilepsy and ADHD, there are concerns of stimulant medication being a trigger for seizures. The risk appears minimal, and stimulant medication can reduce ADHD symptoms for people battling epilepsy. To learn more about ADHD and epilepsy, please check out our resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos on our channel and subscribe today. You have the power to defeat epilepsy.